Thank you for joining The Bridge Shift today, an avenue to tell inspiring stories and understand those who tell them. It is our medium for live conversations with inspirational change makers. Hi, my name is Farah Hillou and I'm your host for The Bridge Shift. Today, our guest speaker is Dr. Bart Piechovski. He has a notable educational background in medicine and is registered in the Institute of Functional Medicine. Dr. Bart was a consultant neurologist at King's College Hospital and led a successful private practice in London. He currently sees a breadth of neurological conditions overlapping with functional medicine, including chronic COVID, fatigue, headaches, and memory problems, to name a few. In conversation with our very own Farah Hillou, registered dietitian, integrative and functional nutritionist. Today's topic will be about resilience in the times of COVID. You will learn why COVID has affected us badly, who was and still is at risk, what can we do to build resilience, and how to deal with long COVID.
Thank you, Dr. Bart, for joining us today. And if you'd like to tell us a little bit about yourself, and then we can deep dive into such an important topic. Personally, I can relate to myself as well, since we just had COVID last month.
Okay, so Farah, thank you so much for this kind introduction and for allowing me to come here and so we can have this very important discussion. So, as you said, I'm a physician. I specialize in neurology, but my great interest and my heart is with integrating the sort of mainstream medicine with functional medicine to offer everyone the benefit of knowledge that is available. And I think this is of great importance in these difficult times that we've been going through currently. Yes.
And it's, the fact that this is something that hit the entire world, and we were all really confused in the beginning, and we soon found that we had to, find a way to live with this. And no doubt it affected our mental health, our physical health, our emotional well-being, our behavioral aspect of health. So from your perspective, why do you think COVID has affected us in such, in the way that it did?
Yes. So thank you. It's a very deep diving question, to be honest. And I think you named this in a way that it affected all of us. But when we dissect it into the virus and the other things related to pandemics, it gives us like a broader and deeper picture and allows us to understand it more. So the virus we can't see, it came. Some people got sick, some people did not get sick. But our life changed because of the regulations around the virus. So countries were locked, schools were closed, jobs were shifted from office to home. So there was a great impact on how we function. So our lives were changed. And I think the impact of the virus needs to be seen from the perspective of an infection itself, which affected some of us, but and the pandemics and the lockdown and everything that affected everyone was.
Absolutely.
And there is a common denominator connecting both, of course.
Which is?
Which is inflammation.
Yes, absolutely. Yes. In functional medicine, definitely, we always see, we're both so passionate about functional medicine and functional nutrition, and we often see inflammation as being the root cause of so many chronic conditions that we're dealing with nowadays. So, when it comes to, let's say, COVID or just the immune system in general, how can we integrate or how can we talk about inflammation in this context?
So I think that the impact of COVID needs to be seen in the context of it came at the moment when the global population was inflamed already, even without COVID. So we know that approximately 55 million of deaths per year are caused by inflammatory conditions. But I'm not speaking about joint inflammation. I'm speaking about conditions that are caused by inflammation, such as heart disease, strokes, cancer, dementia, and similar conditions. So this was the epidemics before COVID started. Yes. So these conditions are responsible for 70% of deaths before the age of 70. So we call them premature deaths. So already the landscape was not great. Yeah. And then COVID came, and it's like you had this petrol spilled on the ground, and you just ignite it with another trigger. Yeah, so that's basically where we are. But the good thing is that 80% of all of these bad conditions related to inflammation are preventable.
Yes, absolutely.
Yeah? So the strategies that allow us to combat those and to deal with COVID and prevent us from long-term COVID are same.
Absolutely. Yes. And before we talk about how can we prevent, in functional medicine we always ask the why. So why are we an inflamed population or people? What is causing this inflammation? To start off with, is it an external thing? Is it an internal thing? What is causing this inflammation?
Yeah. So when we see ourselves in the mirror, we see us as we are today, but we also need to understand that the way we are, the way we look, the way we feel, it reflects to all of the years, the weeks and months that we spend on this earth, from the birth and even from before birth.
Yeah.
So when we are conceived, the environment in which our parents function is sent to us through the epigenetics. Yeah. So we are born the way our parents were. Yeah, so our genes are read the way they were. So then we grow up, and when we having lots of infections in the childhood, we intolerant to milk, to gluten, we stressed, we press to progress, achieve, and all of this. Yeah. We develop stress, and we can say it's like a form of a PTSD that starts from childhood. Yeah. Yes, and then as the life goes on, we get promotions, we get degrees and everything. The stress builds up, and the PTSD grows with us. So stress is the way of living. Without stress and without physical friction, we wouldn't be able to walk and function. But too much stress, as we know, causes inflammation, and this can be checked with some lab tests, CRP, interleukin-6. So there is huge evidence connecting, for example, social media use with stress and inflammation. Yes. So there are many factors. A lot of them are external, but a lot of them are also internal. So among those is the intolerance to food, as I mentioned already, and the direct effect of stress on our gut function, causing leaky gut, and again bouncing up all of these inflammatory parameters. So there are multiple factors that make us inflamed.
Yes, I absolutely agree, and it really does start from from day zero, really. And this is why we really want to focus on maternal health and maternal well-being. And I think we underestimate the effect that maternal health, and then the mode of delivery and breastfeeding, all of this. We underestimate, I think, the effect that it has on the long term, 20, 30, 40 years down the line. And, going back to what you were saying, I think a lot of us thrive when we are stressed, when we want to achieve so much. And we also we take it for granted, the effect that this has on our system in general. We're constantly, on the go. And we know that, inflammation in the short term can be a good thing. When you bump your hand or you have a cut, inflammation is actually needed. It is a good thing. It helps you heal. But this low-grade chronic inflammation that our body is exposed to, and of course we know that, for example, individuals who maybe are obese or who have chronic health conditions tend to have more inflammation. But inflammation can also be there in someone who looks healthy. They can look healthy, but they can still have inflammation that's going on in their body because of their lifestyle or what they eat, or smoking. So inflammation sometimes is hard. You can't see it, you can't measure it,
of course,
or you can't measure it just by looking at someone. But of course, as you mentioned, there are definitely tests that we can base our let's say medical assessment on, and then take it from there. So again, when when we talk about the pandemic and the fact that it started off the way it did, and things got worse because we are an inflamed society. So in terms of inflammation, what could we do to really promote an anti-inflammatory way of being?
Yeah, so it's a very good question, and I think you mentioned a very important thing. People may not be aware that the body is inflamed, and also healthcare professionals may not detect that, because you may not feel unwell, but there are very subtle things like mild memory problems, forgetting words, having mild brain fog, aches here and there, that for the careful eye and ear may sound okay. Let's take a look at you. You're healthy, you seem healthy, but when you scratch behind the scenes a little, things come up. So I think to answer your question, what we can do with all of this is basically, first of all, shift the understanding of health, this not being an absence of disease. Health is an asset that we work hard for every day. So there's no health without work. And we know there are some biological health assets. One of them is heart rate variability, for example. People are using, mobile technology, smartwatches and everything. This is an easy thing to measure. And I think it's a great parameter which shows us where the balance in our bodies is. Are we in a sort of a stressed spectrum where the heart and our autonomic system needs to go like in a race car?
Fight or flight mode, right?
Yes, so then the heart goes very regular rhythm because we need to have like tighter responses to the stimulants from the external world. The other system in our body, the parasympathetic, the system of tranquility, healing, is the one that disrupts this rhythmicity. So more heart rate variability there is, the more influence from the parasympathetic system we see. So this is an easy numeric parameter that we can assess on a daily basis.
Yeah, so the heart rate variability, and it's really also one of my favorite tools, it's really, many people, particularly when they work out, they focus a lot on heart rate. But what we really want to shift the focus on is heart rate variability. So heart rate variability is really the milliseconds that happen between your heartbeats. So when you're stressed, or when you're exercising very rapidly or intensely, your heartbeat is pretty fast. So your heart rate variability is small, or short, which is not a good thing.
Yes.
When we are in a relaxed state, our heartbeat is more regular, our heart rate is more regular. The heart rate variability is kind of further or longer apart. So that's really what we want, right? Sure. So, and I also tell my clients that when we can't be in both systems, a sympathetic fight or flight or a parasympathetic rest, digest, heal, detoxify state. It's either here or here. And, we are accustomed to, being on the sympathetic nervous system, even whether the body doesn't differentiate whether it's a physical stressor or a negative thought or a bad memory. The body internally responds the same way, no matter what the stressor is.
Sure.
So the adrenal glands are pumped up, adrenaline, cortisol are pumped up, and then that constant low-grade cortisol is leading to the inflammation.
Of course.
So and then if we are on the fight or flight mode, it's going to come at the expense of our body's ability to heal, to digest very well, detoxify. So it's here or here, right? And this is where the vagus nerve, where we talk about the vagus nerve.
Exactly. So this is the place where we can, because it's like a balance. So it's like yin yang. Sometimes the whiteness disappears completely from the picture, and it's dominated by sympathetic system. So what I tell my patients is that we have a very useful tool when we can take over control of the autonomic system. It may sound like an oxymoron, how we can control something that is automated.
Yes.
But there is one thing we can do, and this is through, of course, the breath control. So breath work, either through yoga or through just focus on breathing, 4-7-8, box breathing, all of this allows us to control the balance. So slowing down the breathing ignites the parasympathetic system on. So what I tell my patients who are exposed to lots of stress at work or at home is whenever you feel it's coming to you, the stress like you burst, just slow down and breathe slowly. The same is for the exercise. So people think, yes, I have a healthy lifestyle, I do CrossFit 5 times a week and then weights 3 hours a day, heart rate 200, super. No, it's not, because this is a stressor to the body. So someone calculated that I think we have like 600 billion breaths for life.
Wow.
Maybe the number is not exact, but I think it was somewhere in that range. So if we think that we have a definite number of breaths, and when we sort of go beyond that, it's basically it.
Not a good thing.
So slowing breathing also during exercise allows us to defend our systems from the stress-related damage. Yes. So I think this is beautiful because it's numeric, heart rate variability, and we have many tools how we can get there.
To maximize it. And at least from my end, really, I really focused a lot on breath work during the pandemic because with home schooling and, working from home, there was a lot of stress involved and then the fear of the media and whatnot. So I really felt like breath work really helped. And, going back to the pandemic, what do you think, helped us become resilient? And what do you think we can do to continue to build on this resilience, be it from a mental, emotional, or even a physical aspect?
So I think, first of all, initially it was something new to all of us. It was great fear. And fear is stress. And we go back to the same mechanism that we touched at the very beginning. So if there's less fear, there is less stress, there is less inflammation. Now, there's lots of evidence supporting what isolation did to people and does to people, how it provokes stress and weakens our immune system. So having less fear and trying to connect, maybe not necessarily physically connect, like meeting in sort of crowded rooms. We know what the rules were of the isolation, but people were even having friend meetings using social media. Exactly, but this is the way to go over it. Your immediate family is your immediate tribe, your group. Yes, so all of these aspects of the social life, having less fear and getting exposed to nature, to sunlight, waking up with the sun, walking in the greenery, seeing the blue color of the sea and ocean. All of these are very natural signals to our body that we are fine. Yeah, so these are soft things someone can think, but there's lots of evidence of all of these strategies supporting health and resilience, and even stepping with your bare feet on Mother Earth. Yes, grounding. So going on a beach, putting your foot in the wet sand, it allows all of these electrons coming from Mother Earth and calming down all of the areas of inflammation. Again, there is this huge research about that, lots of information available.
The beauty about integrative medicine and functional medicine is that it is evidence-based. All of these simple things that we can do in our day-to-day life, we don't always need to reach out for that medication. Sometimes it's just making tweaks to how we decide to live our lives every day, what we can incorporate, what we can, gladly let go of. Those things can really help make a difference and elevate our overall health. Let's talk about food as medicine, which is a big thing, of course, in functional medicine and functional nutrition. So again, in terms of helping us build this resilience, for years to come, and now we know that quite a few people are dealing with long COVID. We'll discuss this maybe in a short time, but how can we make sure that physically, the viruses and the microbes, we are exposed to these on a day-to-day basis. Ultimately, what's going to dictate if we're going to be affected by these is how resilient we are. So where does food fit in?
So as you said, food is medication and lifestyle is medication as well. So these are very powerful tools. So of course with food, we were created as hunters and gatherers. So we were made for scarcity, not for abundance. So whenever abundance hits our life, that's the state of illness, inflammation. So this goes straight away into intermittent fasting that now in the time of Ramadan has specific value, time-restricted eating, and of course what to eat. So just very quickly with the intermittent fasting, time-restricted eating, we allow our body to burn all of the unnecessary elements at the cellular level and the body level, and switch our metabolism to ketones for a while, which is very has some good health effects. Now, food-wise, you, the expert, I also guide my patients with this, but of course, our nutrition should be rich in all of the colors of the rainbow. Of course, it's not for us, it's for our friends, our microbiome with phytochemicals to allow them to stimulate our genome to read the codes of health, strength, and immunity. Yes.
And even, there was, during the pandemic and even until now, we find a lot of research that was showing the benefits of, these phytonutrients and polyphenols, like, for example, turmeric, all these bioactive substances in our cabinet, in the food in our cabinet, and the effect on immunity. And, when people were tested positive for COVID, everyone all of a sudden, opened their cabinets. What can I take? Ginger, turmeric, rosemary. But these all contain, they're functional foods that contain bioactive compounds that a lot of these have antimicrobial, antiviral effects. And even, there's data to show that in, let's say, previous, let's say SARS and, all the previous pandemics or whatnot, that they were actually, these functional foods were effective in terms of, breaking down or preventing replication, or very, health promoting, and can promote quick recovery, let's say.
Of course.
So it's, it really does show that the power of food as medicine, during the pandemic and always. So, and particularly when we talk about, a lot of it is plant-based foods and colors of the rainbow and, herbs and spices and, legumes and whatever it is. I think the polyphenols and the phytonutrients and the fiber which feed our gut microbiome. So it's really, it is medicine, it is prevention. It can also be used, sometimes alongside medications when needed as part of treatment and part of management. But it's, definitely worth always investigating, and the research is there.
Yes, the data is so strong, but and you named it very well, because it's one action is anti-inflammatory, the other one is of course with the antioxidant focus, but there is also a function of phytochemicals on epigenetics, so shifting the frame, the reading frame of our genetic code towards health. So this is very powerful, and as you said, also avoiding foods reaching unnecessary carbohydrates, processed foods, sugar, our enemy fructose, which is responsible, of course, for bouncing up uric acid, causing inflammation, causing gut, leaky gut, and all of this. So low glycemic foods. And also maybe not eating too much meat and animal protein with the purines, and again going through the uric cycle pathway. So yes, but most of this, I think there was research saying that people who were given flu shot, the research divided people into groups. One group was skeptical, and the other group was optimistic about the flu shot. And they measured the immune response to the flu shot. So the group that was optimistic had better immune response to the flu shot. The reason I'm quoting that, it's not COVID, but our will and our attitude is very powerful. So even if we eat a food that is maybe not so great, but we sort of think, okay, this is for good. I'm not saying that this will miraculously, the spell will be taken away from that, but the attitude is also important.
The attitude and being, mindful about what you're doing. And, we also like to talk about behaviors and mindful eating and the importance of that, and, what choices we make. And if you have that, I don't know what it is, but, that dessert once in a while, that guilt, not to feel that guilt, but we always say it's what you do on a day-to-day basis that will really determine your overall health, and will determine that, let's say, shift in your epigenetic expression, and will really determine how you feel, and ultimately learning to tune in and listen to our bodies.
And the guilt you mentioned, this is the PTSD that we were brought up with, and the society is pressing us not to lose it, because then we are controlled. Why feeling guilty after having a nice crème brûlée, for example? If we say it's for the great purpose, and specifically if you have it with your friends, let's say friend o'clock, you can skew from super healthy eating. What is important is that you have it, a part of the group. So one of the established healthcare assets is oxytocin level, and oxytocin goes up when we hug our loved ones, children, our partners, but also when we socialize with our friends and people that we grow with. So it builds up our immunity and our resilience as well.
So yeah, absolutely. Community, and what I'm understanding from you, Dr. Bart, is really the community is also at the essence and one of the foundations of building resilience. And we spoke about food, and we spoke about the importance of addressing, inflammation, and, really focusing on what our ancestors really used to do and not the abundance that we're so used to eating, and the importance of gut health as well in terms of resilience.
Yes.
What about, people who are struggling, let's say, with chronic conditions, be it long COVID or, insulin resistance, which we're seeing nowadays, and hopefully we can address this one, in our next talk. But, moving forward, what can we all do daily, in addition to everything you mentioned, breathing, grounding, etc., but to really optimize our health and continue being resilient to everything around us, mentally, physically, spiritually, emotionally. What can we continue to do?
Yes.
And what would be your take-home messages?
So my take-home message is that no matter where we are in our life, health-wise, age-wise, geography, work, always we can get the best of us. The best, what we were basically brought to this planet for. We all have same purpose to become powerful, happy, and help others around us. This is across all of the possible cultures. It's same. So if someone suffers from long COVID, behind that there are things that were happening before COVID. So it's just shedding light into this, seeing professionals like yourself, functional medicine physicians, health coaches, to allow to dissect and prioritize certain things, what strategy should be used. And again, it goes back everything to the things that we discussed. So let's say it, healthy lifestyle, grandma recipes, yes, when they were telling us, oh, take a breath when you're nervous.
Yes. That's true.
Yes.
We should have listened.
So the best resilient food you can imagine, one of them is just a simple vegetable curry. Yeah. You have the colors of the rainbow, you have healthy mid-chain triglycerides in coconut milk, you have all of the spices. So turmeric goes with chili. So without chili or black pepper, turmeric will not have that
bioavailability.
Beautiful anti-inflammatory effect. So it's all there. We just forgotten to read the old recipes, old books, and listen to the previous generations. But do it with a smile, and then smile to others, and just be good to yourself. I think that's in a nutshell. Of course, it can all be tailored to the individuals.
Yeah, absolutely. And this is, again, the beauty of functional medicine, where we have all of these amazing recommendations. Ultimately, each person is their own unique individual with their own genetics and their own exposures and their gut microbiome, etc. So we always target our treatment according to each. And this is where, the multidisciplinary team comes in, and, we each complement. And sometimes, a person is given recommendations, but then they need to know how to implement it. And this is where coaching comes in, and, to really support an individual and empower them in terms of, okay, I have this information now, I feel better, but, how can I do it as well? How can I be consistent with it and do it in the long term? So thank you so much, Dr. Bart. This was really a lovely talk, very, I think, empowering. And it's really going back to the basics of what we can do, things that we forgot about, that we need to be reminded of, and to really seek help from someone who can address all of these root cause imbalances and personalize our recommendations and use, everything that you mentioned on a day-to-day basis. So thank you so much, and we look forward to our next chat.
Yeah. So
thank you.
Thank you so much, Farah. And I think what we are doing now, the discussion that we're sharing with people, it's the way to go. So we start the thinking around that, and that opens a nice platform to expand this further and sort of go deep into all of these pockets that we just opened.
So Dr. Bart, can you tell us what really inspired you to be on the journey, your career journey that you're currently on? I know, your background as a neurologist or neurosurgeon, and then, you've also shifted, you're still practicing what you're doing, but you've also taken a turn towards functional medicine.
Yes. So Farah, thank you so much for this crucial question. So I've been in the field of neurology for the last 25 years, dealing with strokes and people, intensive care, very grim neurological conditions. And I've been questioning myself, do I do my best to help them? Do I understand everything? And I came to the point where I had more unanswered questions that really I could understand what is happening with people. And then I, accidentally somehow shifted towards exploring additional areas, and I found out functional medicine. And after listening to the first lecture, for me it was a revelation. I was enlightened with the depth of the knowledge, the evidence base for that, and how it explained most of the areas where I had question marks. And also myself, I went through a significant life change. Even before starting doing functional medicine, I decided to treat my body well. Instead of overdoing it in a gym, I started doing yoga. I slept better, I changed my nutrition, and I felt better. So my own example showed me that you can achieve many things. So in a nutshell, that's what
and
made
what
me,
continues to inspire you? Do you feel like you're able to help clients?
Yes. So I
better?
have many patients that come to me with chronic conditions, and after lifestyle interventions, nutrition interventions, supplements, exercise advice, breathing suggestions, they come back and they say, "Doctor, I've never felt like this in my life." And also they say, "For the first time, I'm not treated as an organ, I'm treated as a person. And thank you for being my friend in this journey." So the physician-patient relationship goes into sort of a horizontal. So we become partners. I show my vulnerability. I speak about my medical past, my disease that I went through recently, how I recovered, and I'm inspiring people around me, patients, colleagues, and everyone. So it's great that I can carry the lantern of hope.
Yeah, that's beautiful.
Yes.
Really, that's beautiful, and especially when you can relate and when you're approaching it from a holistic, integrative perspective. And so, thank you so much. Where can patients or clients find out more about you, and how can they reach out to you?
Yeah, so I'm very much open to answer any questions and to also to any comments. The details for my contact will be provided to you down below. So please feel free to reach out with anything, and I'm here for you. So,
perfect. So we will be sharing Dr. Bart's contact details. Thank you very much for watching and for being with us today. We hope you found this informative. Please stay tuned for our next The Bridge Shift.